This video begins with a brief overview of health history taking, followed by anatomy of the skin and its appendages, examination of the skin, examination of the hair, and examination of the nails. We conclude the video with tips on describing your findings. You will see the examiner assess a healthy patient. In clinical practice, you may detect the same normal findings, or you may discover normal variations or abnormal findings. The health history interview is a conversation with a threefold purpose: to establish a trusting and supportive relationship, to gather information, and to offer information. In the case of new patients, you will gather information that will form the basis for a comprehensive written health history. For patients seeking care for a specific complaint, you may prepare a more focused, problem-oriented history. In either case, you will record the patient's chief complaint, along with common or concerning symptoms. Common or concerning symptoms relating to the integumentary system include hair loss, rash, moles, and changes in the nails. By eliciting the patient's concerns before the examination, you prepare for an examination that is efficient and productive. The skin is the heaviest single organ of the body. Its major function is to keep the body in homeostasis despite daily assaults from the environment. The skin provides boundaries for body fluids while protecting underlying tissues from microorganisms, harmful substances, and radiation. The skin also modulates body temperature and synthesizes vitamin D. The most superficial layer, the epidermis, is thin and has no blood vessels. It is divided into two layers: an outer horny layer of dead keratinized cells, and an inner cellular layer where both melanin and keratin are formed. For its nutrition, the epidermis depends on the underlying dermis, which is well supplied with blood. The dermis contains connective tissue, sebaceous glands, sweat glands, and hair follicles. The dermis merges below with subcutaneous tissue, or adipose, also known as fat. Sebaceous glands produce a fatty substance secreted through the hair follicles. These glands are present on all skin surfaces except the palms and soles. Sweat glands are of two types, eccrine and apocrine. The eccrine glands are widely distributed, open directly onto the skin surface, and help control body temperature through sweat production. In contrast, the apocrine glands are found chiefly in the axillary and genital regions. They usually open into hair follicles and are stimulated by emotional stress. The color of normal skin depends primarily on four pigments. Melanin, the brownish pigment of the skin, is genetically determined and is increased by sunlight. Carotene, a golden yellow pigment, is found in subcutaneous fat and heavily keratinized areas such as the palms and soles. Oxyhemoglobin, one of two forms of hemoglobin, is the bright red pigment that predominates in the arteries and capillaries, while deoxyhemoglobin is the darker and somewhat bluer pigment occurring when oxyhemoglobin loses its oxygen to body tissue while passing through the capillary bed. An increased concentration of deoxyhemoglobin in cutaneous blood vessels gives the skin a bluish cast known as cyanosis. Skin color is affected not only by pigments, but also by the scattering of light as it is reflected back through the turbid superficial layers of the skin or vessel walls. Appendages of the skin include the hair and nails. Adults have two types of hair: vellus hair, which is short, fine, inconspicuous, and relatively unpigmented, and terminal hair, which is coarser, thicker, more conspicuous, and usually pigmented. Scalp hair and eyebrows are examples of terminal hair. Nails protect the distal ends of the fingers and toes. The firm, rectangular, and usually curving nail plate gets its pink color from the vascular nail bed to which the plate is firmly attached. Note the whitish moon or lunula and the free edge of the nail plate. The proximal nail fold covers roughly 1/4 of the nail plate, called the nail root. The cuticle extends from the proximal nail fold and, functioning as a seal, protects the space between the fold and the plate from external moisture. Lateral nail folds cover the sides of the nail plate. Note that the angle between the proximal nail fold and the nail plate is normally less than 180 degrees. In conditions of chronic hypoxia, however, you may detect clubbing, in which case the nail plate may become more convex, with the angle increasing to greater than 180 degrees. Inspect and palpate the skin, noting its color, moisture, temperature, texture, mobility and turgor, and any lesions. A patient may notice changes in skin color before you do. Ask if the patient has noticed any such changes, specifically increased pigmentation, most often increasing brownness, or loss of pigmentation, redness, pallor, cyanosis, or yellowing of the skin. The red color of oxyhemoglobin and the pallor resulting from a lack of it are best assessed where the horny layer of the epidermis is thinnest and causes the least scatter, at the fingertips, lips, and mucous membranes, particularly those of the mouth and palpebral conjunctiva. In dark-skinned patients, inspecting the palms and soles may also be useful. Central cyanosis, reflecting central arterial oxygen desaturation and increased deoxyhemoglobin, is best identified in the lips, oral mucosa, and tongue. By contrast, peripheral cyanosis is best identified in the nails, hands, and feet, where the bluish cast arises from increased oxygen extraction by the peripheral tissues. Look for the yellow color of jaundice in the sclera. Jaundice may also appear in the palpebral conjunctiva, lips, hard palate, undersurface of the tongue, tympanic membrane, and skin. Assess for moisture, noting characteristics such as dryness, sweating, and oiliness. When assessing for temperature, use the backs of your fingers. Carefully note the temperature of any red areas. Characteristics of texture include roughness and smoothness. To assess mobility, lift a fold of skin and note the ease with which it lifts up. To assess turgor, note the speed with which the skin returns into place. Observe any lesions of the skin, noting their characteristics. Note their anatomic location and distribution over the body. Are they generalized or localized? Do they involve exposed surfaces? Note their arrangement. Are they linear, clustered, annular, that is, in a ring, archiform, that is, in an arc, or dermatomal, meaning covering a skin band that corresponds to a sensory nerve root. Finally, note the color of the lesions. Be sure to familiarize yourself with the basic types of lesions. Review their appearances in a well-illustrated textbook of dermatology. Whenever you see a skin lesion, look it up in such a text. The type of lesions, their location, and their distribution, together with other information from the history and examination, should equip you well for this search and, in time, prepare you for arriving at specific dermatologic diagnoses. When examining nevi, apply the ABCDE method for assessing for skin cancer. Inspect for asymmetry, irregular borders, color variation or change, especially blue or black, diameter larger than 6 millimeters, and elevation. Normally, inspection of the hair is conducted in conjunction with palpation of the scalp as you look for any depressions of the skull. Such depressions might indicate head trauma or previous surgery. Inspect the hair and its texture, looking for nevi, lesions, or parasites. Assessment of the nails can sometimes aid in the diagnosis of heart or liver disease, lung cancer, or other conditions. Inspect and palpate the patient's fingernails and toenails, noting their color and shape. Look for any lesions, clubbing, or cyanosis. Longitudinal bands of pigment may be seen in the nails of normal people who have dark skin. A clear, well-organized clinical record, employing language that is neutral, professional, and succinct, is one of the most important adjuncts to patient care. For a healthy patient, your write-up might include language such as color good, skin warm and moist, nails without clubbing or cyanosis, no suspicious nevi, no rash, petechiae, or ecchymosis. To summarize, examination of the skin includes inspection and palpation of the skin, noting color, moisture, temperature, texture, mobility and turgor, and any lesions. Inspection of the hair, and inspection of the nails.